Hello and greetings. I'm Dr. BJ Bose from the Asian Orthopedic Institute from Chennai, and today I'll be discussing the surgical technique of the MonoMod revision stem. Before you see this video, it would be a good idea if you can see the earlier video on the design rationale of the MonoMod revision stem, because you'd find a lot of concepts in the design rationale that will be referred to in this video. The first thing that we do in any revision femur is to choose the length of the stem that needs to be used. This is not exclusive to the MonoMod. This is true for any revision system. The MonoMod comes in four sizes, starting from 190 centimeters, 225 centimeters, 260 centimeters, and 305 centimeters. Now we think now that the minimum of four size is required to handle the various types of femoral revision these days. The first thing that we can do is to template from the X-ray. So from a fixed landmark, we template and then we decide what length to be used. The second thing that we do is we can overlay the trial on the bone, especially if we're doing an osteotomy or something, and then decide which length to use. The third thing we can do is to look at the C-arm with the trial inside, and that will also give us an idea of the stem that needs to be used. Practically, we tend to use a combination of all these three methods. There are three things that we need to keep in mind when we do the MonoMod. The first thing is that the 3 centimeters of a cone-in-cone host bone contact is adequate to get fixation for long term. So just 3 centimeters is enough when you have a tapered stem and a cone-in-cone fixation. Now this is in contrast to a cylindrical stem where you need a scratch fit of about 5 centimeters. Whereas in a cone-in-cone fixation, titanium stems, 3 centimeters of host bone contact would suffice. Second thing is, although we need only 3 centimeters, we usually suggest that you aim for 5 centimeters. So even if you fall short slightly, it will still be a safe option. You cannot run short. Another important technical note to take into consideration is that the distal 1.5 centimeters of the stem does not participate in fixation due to the taper. So when we are calculating the 5 centimeters required, we must not include the terminal 1.5 centimeters for the MonoMod. That's because of the taper. The key aims of any revision surgery on the stem side as regards the surgical techniques are two. Number one is to achieve soft tissue balance proximally, which is called as the hip balance. Number two would be to achieve rigid distal fixation, which we call as stem stability. So hip balance and stem stability are the aims of any revision surgery on the femoral side. Now, if we take a monoblock stem like the Wagner, it tends to achieve these two steps through one unified surgical step. Frequently, this leads to compromise in one goal or the other, and therefore we'll end up with problems. Typically, we'd end up with subsidence or dislocation, which are higher with the Wagner stem. However, when we use modular revision stems, we find that we can achieve rigid stability distally using the distal segment of the prosthesis, and then we add up whatever segment is necessary proximally to achieve soft tissue balance. So thus these two steps are achieved individually, and we're able to achieve these two goals very well. In the MonoMod, we have split this one surgical step into two steps, although it is still a monoblock stem. So the phases are, the first phase is the balance phase, where we use the black markings. The black markings corresponds to the head, center of the head of the prosthesis. So this usually corresponds to the tip of the GT, and using this we achieve soft tissue balance of the hip, and that is known as the balance phase. And once we achieve the balance phase, then we use the colored markings on the rema. This we call a stability phase. So we use the shoulder of the prosthesis as our reference, and then we achieve the stability of the prosthesis. So just like in a revision stem, like a modular revision stem, we are able to achieve the balance phase independently and the stability phase independently with the MonoMod, although still it's only a monoblock stem. And that's how it gets its name, MonoMod. First, we come to the balance phase. This has got three components to it, namely reaming, trialing, and fine-tuning. Just like in any other system, we start with the smallest reamer, and we keep upsizing the reamer till we come to a reamer size that has got some hold or bite in the bone. Now, depending on the length of the prosthesis we have chosen, we want to leave that particular black mark corresponding to the length that we have chosen at the level of the tip of the trochanter. Now, we remove the reamer and insert the trial prosthesis. Now, the head of this prosthesis matches the tip of the great trochanter. We are now ready for trial reduction. Based on the findings of the trial reduction, we now do fine tuning. Now, suppose we find that the soft tissue tension is very lax, we go to the next reamer and next trial and leave now the center of the head higher than the level of the tip of the trochanter. Conversely, if the hip was too tight and we found difficulty in reduction, we tend to ream further down and now sink the trial little down, and therefore the center of the head now lies below the level of the tip of the great trochanter. Now, once we have done that, we have now established an ideal soft tissue tension, which we now refer to as the ideal hip balance. It's important to keep in mind that the balance phase trial is typically 1 to 2 sizes smaller than the stability phase trial and the final implant that's going to be used. Now we'll see a video of the balance phase trialing being done. Now in this particular example, we're going to use a 190 MonoMod stem. The MonoMod reamer has got black markings for all the stem lengths, and we take the 190 black mark which corresponds to the center of the head of the 190 trial. So now I'm marking the tip of the GT. I start off with the 12 reamer, which is the smallest size with the MonoMod, unlike the 14 of the Wagner. So we want to make sure that the black mark of the 190 corresponds to the tip of the GT. So 12 is very loose. So we go to 13. 13 again goes very easily. The black mark of 190 passes the GT very easily. Then we go to 14. Then we go to 15 now. Again, I want to make sure that the black mark of 190 corresponds to the tip of the GT. I'm able to pass that very easily. And I go to the next reamer, which is 16. And now I seem to get a bite. So this is going to be my balance phase trial. So you can see clearly now that the black mark corresponds to the tip of the GT. So I'm taking a 16 trial 190, and you can see how that black mark should be made to correspond with the GT, and this corresponds to the head of the trial and the head of the process. So this you can see that how all three correspond. Now I'm taking the trial, I'm impacting it at 20 degrees of functional lower limb version, which is the default version, unless we want to change it. Now you can see that I put it in 20 degrees of version. So I put my 16 balance phase trial, and I'm going to now do a trial reduction. Now I've done a trial reduction, and I find that the hip is too lax. The soft tissue tension is too lax. So I'm going to remove this trial, and now I'm going to ream with a 17, but I'm going to leave the black mark above the level of the GT to increase the soft tissue tension. So you can see now the 17 reamer, my black mark for the 190 is now above the level of the tip of the GT. And now I'm going to, you can see that very clearly here, and I'm going to put a 17 stem, again in 20 degrees of FLLV. And then I'm going to do a trial reduction again. Now in this trial reduction, I find that the soft tissue tension is precise. So now I have established my hip balance. So we have ideal soft tissue tension and the hip balance has been established. Once we have achieved the ideal soft tissue tension or the hip balance, we can now move to establishing the BRM or the bone reference mark. The bone reference mark is a mark that we make on the bone with a pen or a cautery, which corresponds to the level in which the shoulder of the process is sitting. This level, of course, gave us a very ideal hip balance. The BRM corresponds to the shoulder of the trial in the process, and it refers to the colored markings on the reamer, in contrast to the black markings of the reamer, which corresponds to the head of the trial or the process. In some patients, the proximal femoral bone may be missing, and in this case, we use a specialized MonoMod ruler, and we reference off a fixed bony point distally, and the BRM is now made on the MonoMod ruler as the proximal femoral bone is missing. Now, once the BRM is made, reference is now passed from the head of the process or trial to the shoulder of the process or the trial. It's very important because the head of the process is in space and therefore any measurements is very inaccurate. In contrast, the shoulder of the prosthesis or the trial is in close proximity to the bone, and if we use a shoulder reference, we are now able to micromanage where we leave the trial of the prosthesis up to a millimeter. In this video, we can see how we mark the BRM. So I've established a very good soft tissue balance in this patient. Hip balance is good. So now I'm going to mark the BRM. So depending on where the process is sitting, I'm going to make a mark with a cautery on the bone. But in this particular patient, the proximal bone is very mobile as there is a lot of bone deficiency proximally. So this mark is not going to be accurate. So I'm referencing off a fixed bony point distally, and I'm going to use the specialized MonoMod ruler to make the BRM. So referencing off that fixed distal point, I'm going to mark the shoulder of the prosthesis on the MonoMod ruler. I can see now I'm marking it, and now this gives me a very accurate BRM, which in turn will give me a very accurate level to seat the prosthesis in the further steps. The next phase we go on to is the stability phase. Now, just like our balance phase, the stability phase has got reaming, trialing, and fine tuning. Now, we saw how the BRM was established. So now we start reaming further so that now we get stability. We have established balance. Now we upsize the reamer till we find a reamer that gives us good distal stability. So we use hand reaming or power reaming till very rigid stability is achieved distally. And this now we are going to match to the color markings on the reamer, which will correspond to the BRM or the shoulder markings. Now the MonoMod reamer may have three colors, the red, yellow, and green, depending on the size of the prosthesis. So smaller size will have red, the intermediate size will have yellow, and the larger size will have a green markings because the offset of the trial matches that of the real prosthesis very accurately. So we upsize the reamer till we get very excellent rigid stability. Now we put the next trial in, which we call as the stability phase trial. And the important point here is, depending on the type of bone, whether it's sclerotic or osteoporotic, the shoulder may not match a BRM. Just like how we do an established socket, sometimes you may have to ream more, sometimes you may have to ream less. So if you find that the shoulder of the prosthesis, although you have reamed till the BRM, the stability phase trial shoulder does not reach the BRM, then you need to ream more. So you need to ream more. You can see how the colored marking has now gone further than the BRM, so that the stability phase trial shoulder will now match the BRM very accurately. This is very important. Only if we do this, we'll find that there will be precise seating of the implant at the same level to get both the balance and the stability. This is a video illustration of the same concept. We have now established the BRM based on a balance phase trial. It's now time to move to the next phase, which would be the stability phase, which has also got three components like the balance phase, namely the reaming, trialing, and the fine tuning. In this particular patient, we have chosen a 190 length MonoMod stem. The shoulder corresponds to the colored markings on the reamer, and this has to now match the BRM for us to move forward. So that is the concept. Now we look at the video. Our balance phase trial was 17, and now I'm going to try and see whether I can take the red reference mark in the 17 reamer past the BRM. I can see that as I ream, I'm able to take the red reference mark past the BRM. That means the 17 size is not going to give me stem stability. I need to upsize this stem. So I take the next reamer, which would be the 18 reamer, and try and see whether the red reference mark would now match the BRM. Now, in spite of my best efforts with hand reaming or manual reaming, I'm unable to advance the red reference mark up to the BRM. So now it's time to do some power reaming and reshape the endofemoral canal to match that of the prosthesis. Now with power reaming, I'm able to advance the red reference mark of the 190 to the BRM level. So now I will use, I can see that it's a very accurate match. Now I'll use the 18 trial, which is going to be our balance phase trial, and see whether I can get it down to the BRM. Now, as I impact it, I find that I'm unable to get down to the BRM level. That's because of the presence of sclerotic bone. This is very common. And just like on the socket side, sometimes you have to ream more, sometimes ream less to get to the desired level. So I'm going to take the 18 reamer again and try and advance it further so that I can seat the trial where I need to be at the level of the BRM. So I'm advancing the 18 trial by power reaming. The red mark goes beyond the BRM. Now I'm inserting the stability phase trial, and now we can see there's a very accurate match of the stability phase trial to the BRM. So now we have achieved our objective. Now that we've achieved stem stability, it's time to move on to the final definitive component impaction. Now this is the definitive component, and you can see that in the MonoMod, the real component will match the final trial in all aspects, especially the offset. This is not true for other stems, like the Wagner, where the offset of the real component will be different than that of the trial. So the aim now is to match the shoulder of the real component, the definitive component, to where the stability trial was sitting. So I have now taken the definitive component, and I'm going to now impact it in 20 degrees of functional lower limb version. The important thing about this technique is that you must allow the component to seat fully. You must not hold back. Now you'll see that I'm not even watching where it's sitting, and only after full impaction I'm going to see where it is sitting. This is very important, and this is the way how we can avoid post-op subsidence. So now you can see how it is set exactly where the stability trial was sitting. Now no matter how much you impact now, the process is not going to advance. So this gives you a surety that this will not subside in the post-op period. You can see that I've impacted it in 20 degrees of functional lower limb version. So now I reduce the component, and the soft tissue balance is excellent. Now if you want to measure the combined version, and if you have a technique to do that, you can do so as well. And since we have factored in the functional lower limb version, we'll get a very precise combined INT version as well. The key aims of stem cell revision surgical technique is to achieve a soft tissue balance proximally, which we call a hip balance. And number 2 is to achieve a rigid distal fixation, which we call a stem stability. And number 3 is to have an accurate functional lower limb version. Now you can see how we have achieved all 3 goals of revision stem site surgery. So in this video, we covered the nuances of the MonoMod revision stem. As you could see, that this is an example of a second generation monoblock femoral revision stem, and this has got specific advantages over the first generation monoblock femoral stems. I really hope that you found this video very useful. Thank you for your attention.